Good morning. Welcome to our Tuesday Q&A session before I start consults at Gibbons Facial Plastic Surgery. I'm Dr. Victoria Gibbons, your favorite female facial plastic surgeon here in Austin. I have a couple of questions that I've gotten over Instagram that my staff has compiled for me. Thank you all for sending things in. This month is going to be all about rhinoplasty, including a surgical rhinoplasty, a liquid rhinoplasty, and then a non-surgical procedure called the MicroInfusion Facial. I've actually gotten a ton of questions about the MicroInfusion Facial. What is it? And so MicroInfusion Facial is basically a customized or personally tailored mixture of ingredients that help to give you a vibrant glow on your skin, and it also helps to improve texture, some tone, and just in pore size overall. It's great for a pre-event. So if you have an event coming up in a couple of days, it's a great in-office procedure to do. It does not take much time and there's no downtime. So I recommend getting it done about 24 to 48 hours before your event, so you have nice, beautiful, glassy, glowing skin. Next question I got was, what is a liquid rhinoplasty? I'm going to go into more detail throughout the month, so just keep on checking my stories. But a liquid rhinoplasty is basically a non-surgical alternative to a surgical rhinoplasty or a nose job. So it's basically where I use a specific filler to place into certain areas of the nose. So generally patients come in, and if they have a dorsal hump, which is a bump that goes across here, I will put filler above and below to make it look more straight. It is not a permanent fix, but if you don't want surgery up front, or you'd like to see how something may look having surgery, that's a great option. And it can also adjust a few things in the tip, but generally I do not treat anything very wide out here. It does help with some symmetry to correct, but you just have to be very careful in particular and make sure you go to someone who knows what they're doing and you trust, because there are adverse events that can occur even with the best rhinoplasty surgeons performing a liquid rhinoplasty, such as a vascular occlusion, which can cause skin problems as well as potential blindness if injected into a vessel that goes towards your eye. So that is a liquid lift. It is a great procedure. It's not without its risks, but you really need to make sure you go to someone that you trust. And then the other question I got, which is very popular in consults, is if I'm doing a surgical rhinoplasty, what goes inside the nose? So I do put a splint on the outside of the nose, but I don't put a splint inside the nose. I feel like it's much more comfortable for patients. I do inject a dissolvable gel while the patient is asleep in the operating room, so they do feel stuffy during that first week, but as the gel dissolves, they can start to breathe through their nose, and I remove any remnant gel in there, but it's much more comfortable and tolerable than having a splint or a hard object sitting in the nose. Well, that's all the time I have for today. Make sure you submit questions that you have. It's all about rhinoplasty this month and that microinfusion facial. If you have more questions, submit it to us either in our email or through Instagram, and my staff will put it together. And I believe in a couple of weeks, I'll be having another Q&A. Looking forward to having a good day, and I hope y'all do as well. Bye.